Okay. Ebola has been a rising cause in the United States recently. Ebola has been a leading cause of death in Africa, and it has now reached the United States and has scared most of the population. The first case was found in Dallas of a man that came from Africa, and this man he brought this disease over here, and now there's many other people getting it as well. Many questions have come about since Ebola has taken its toll on the United States. Since Ebola has been in the United States, there has been 9 victims of it, and many wonder if they are going to be the next victim as well. There have been precautions taken for the Ebola virus for American citizens, and those precautions have been health professionals taking classes, special classes on what to do. They're trying to find a vaccine, but they really can't find it. Healthcare professionals are also being trained in special ways on what to do, how to take care of it, and how it doesn't spread. The Ebola virus is so small it can't be seen with the naked eye, and it is able to multiply inside of a living host. So that means that it's airborne, and it just multiplies within itself. There's nothing we can really do to stop it. It's considered a member of the RNA viruses known as the filoviruses. The texture of it's long and thread looking. It's also found usually in a U shape. When the virus has entered the body, it spreads by traveling through the bloodstream and somehow is penetrated to the membranes of the cell, and that's how it enters our body. It keeps going into the cells, and the cells just keep multiplying and multiplying, and eventually it's just all in your body, and there's nothing you can really do to control it. The patients that first get infected don't really ever know they have the Ebola virus because the symptoms are so close to the flu symptoms. Symptoms of the Ebola virus include weakness, fever, muscle pain, headache, and sore throat. The patients could also experience vomiting, kidney failure, kidney and liver failure, chest and abdominal pain, rash and diarrhea could also occur. Whenever the patient first goes in, the doctors usually think it's the flu virus, and it takes them about 10 days to fully diagnose the Ebola virus. The first patient to have had Ebola is considered the 0 patient. Other ways that Ebola can spread are by person-to-person transmission, sexual contact, or sharing needles as well. They really can't prove that it's directly from sharing needles unless it's a needle that was used for an Ebola patient. There is no cure for Ebola, but it can be treated. Providing IV fluids and balancing your electrolytes is one of the best ways, and probably the only thing they can actually really do for it. Maintaining your oxygen status and your blood pressure is also one of the biggest things, because it just takes over your lungs. It can make your lungs fail, as I mentioned before. The only thing they can do is if you have other infections, they treat those infections as well. But they don't know if those infections that you have prior to Ebola are what help cause the disease or help you get it. Due to the fact that there is no cure for Ebola, we have to take matters into our own hands and protect ourselves as much as possible. Some of the things and the easiest things we can do to protect ourselves from Ebola are washing our hands, avoiding fluid contact with other individuals, and avoid touching bats and non-human primates. They found that bats and other non-human primates could also be a carrier for this disease, but they can't really prove it just yet, but they're testing on those animals to see if that's where it came from or how it originated from. If you develop fever, headache, muscle pain, fatigue, diarrhea, vomiting, stomach pain or unexplained bruising or bleeding, you should seek medical attention immediately, only because they're just so common of symptoms that we don't really know what to do. There's not a cure for it, so they just really have to keep a close watch on you and let you know, like, this is what you're experiencing, this is how we should take care of it. Just really basic general health skills. Stop it. Is that 5 minutes?